Hello. Welcome to another Facebook Live Lunch and Learn with the Center for African American Health. My name is Deidre Johnson, and I'm the CEO and Executive Director of the Center. For those of you who don't know us, the Center for African American Health is committed to improving the health and well-being of the African American community. We offer community-based, evidence-based disease prevention and disease management programs, a variety of events and services, and we are a family resource center. We're very excited about this conversation today. Please put any questions that you might have in the comment box and they'll be addressed if we have time. Very pleased today to be joined by psychologist Dr. Anthony Young. Dr. Young is the president of the Denver Rocky Mountain Association of Black Psychologists and also served as the past national president of the Association of Black Psychologists. In addition, he's a psychology instructor at the University of Colorado in Colorado Springs. Dr. Young truly understands the stressors and mental health concerns of African Americans, has played a vital role in our community. He has been a longtime supporter of the center, and personally is one of my valued thought partners when it comes to how we can improve access to mental health services for our community. Dr. Young, perhaps you could start us off by talking about the Association of Black Psychologists, how it came into being, and the work that you all do.
Okay. Thank you, Deidre. This is really a pleasure to be able to join you this morning for this noon educational segment online. The Association of Black Psychologists started in 1968 in San Francisco, California, during the National Convention of the American Psychological Association. For years, our members who are African American had really petitioned the American Association the American Psychological Association to address the issues regarding African American mental health. For years, in fact, since its inception, the American Psychological Association had really neglected to address our mental health issues, and in fact had created a lot of psychological tools and interventions which were detrimental to the mental health of African Americans. So in 1968, rather than to continue to petition the American Psychological Association to address our issues, we decided to create our own psychological association. So the Association of Black Psychologists was actually created out of our need to develop proactive interventions and research addressing specifically the mental health well-being of Black people. So our mission is to enhance the psychological well-being of the Black community locally as well as globally. Our chapter in Denver started in 1977. I'm one of the founding members of the Denver Rocky Mountain Association of Black Psychologists, and we provide mentoring for undergrad and graduate students. We actually conduct symposiums and workshops throughout the last 4 decades addressing Black mental wellness. So we're not only are instructors at the colleges and universities, we're also providers who actually conduct psychotherapy and psychological testing in educational settings as well as in clinical settings. So for a very long time, we've been involved with proactively addressing our mental health issues. I should also mention that we also publish the Journal of Black Psychology, which have some very exciting peer-reviewed articles. So if anyone is interested, that would be one way of accessing some of our current research.
So I know we're primarily talking about COVID today, but it's interesting, since 1977, fast forward to today, are there certain trends you all have seen when it comes to our needs that either have improved or just haven't changed at all, that's kind of always a given?
Well, that's a tough question, and the answer is also tough. And it's kind of hard to address the reality of the fact that not a whole lot has changed since 1977. In fact, we have still the same type of preventable physical issues which are affecting our mental health and our mental well-being. We know that overall, African Americans are less likely to engage in help-seeking behavior regarding challenges to our mental wellness due to stigmas, affordability, accessibility, and a lack of culturally congruent services. This need has only been exacerbated with the additional stress and depression resulting from financial problems, misinformation, fear, interpersonal disconnect, and the personal tragedies as a result of COVID-19. So we have a lot of issues which we do not generally address as a people, because oftentimes when we seek help, it's very difficult to afford it. Secondly, even in 2020, we have absence of mental health professionals who are trained to provide culturally congruent services to our people. Less than 1% of all psychologists in the nation are Black, and in Colorado it's even less than that. So we have a shortage of trained professionals to address our mental health issues. So because of all of the stigma which is usually attached to engaging in inappropriate mental health seeking behavior, we tend to seek out help from wherever we believe we can get it. Oftentimes we'll seek out help from the faith-based community. And that's nice and fine, because our faith-based ministers and clergy, they're great for providing spiritual health and support. However, they don't typically have training in mental health issues at all. So for years, we have really worked with some members of the faith-based community to assist them in identifying church members who might need mental health assistance, so that we can help to destigmatize mental wellness, so that we would be more likely to see a counselor, to see someone who is a trained mental health professional to assist us. But once again, we have a hard time addressing our mental health challenges because we have so many other factors impinging upon us, particularly with COVID-19. A number of people have lost their jobs, so they're more stressed out. They were stressed out to begin with. Now with unemployment, that creates a whole nother reality, not being able to even pay bills from month to month. We also know that depression is something which is very common among Americans in general, and in fact, one out of four Americans each year have a diagnosable mental health challenge. And with African Americans, of course, we have the ongoing issues of dealing with anxiety and stress and racism. And that in itself has really exacerbated our ongoing issues just being human. So we have additional stresses impinging upon us. And we also know that with COVID-19, there's a high disproportionate number of African Americans who are suffering from that virus. And no doubt a lot of that, the research is showing, is due to pre-existing medical conditions. So there have been a lot of health disparities pre-existing anyway among African Americans, which have gone, for the most part, not adequately addressed. Now we add COVID-19 to it, and it has really exacerbated our condition.
You know, I want to ask you another question, but I'll kind of be transparent and share a personal thought. You know, when all this first started, I knew, especially, you know, given our mission, that we wanted to do our best to kind of steel ourselves for what would be about to happen with COVID-19. Mm-hmm. As you mentioned, we're being hit harder by it for pre-existing conditions. But what also took me personally by surprise is those other ways. So, you know, no surprise that if you're losing your job, you suddenly are stressed out. My family lost a cousin last week and two this week, one today and one yesterday. And in addition to that, there was that helplessness about not being able to just get on a plane and be together. Mm-hmm. And, you know, we see constantly our young men being targeted out in society. I've got two young teen boys, so I've been talking to them about that, which they're well aware of. But then they've also shared with me that between the two of them, they're in high school, they know 3 former classmates from middle school, all of who OD'd in the past 2 weeks.
Oh, wow.
You've got this firestorm. So when it comes to kind of self-care and just tips that you have, because I know so many of us were raised to, you know what, never let them see you sweat, keep moving, get it done. But how can we really have compassion for ourselves and attend to our self-care in the midst of, it's surreal, so much is happening at once?
Okay, well, first and foremost, um, it's important to always be mindful that danger is real, but fear is a choice. So we have to be very mindful that we should not be in fear, because when human beings are in fear, we tend to make our worst decisions. We tend to be off balance. And it's very important that we recognize the danger, not just in terms of racial profiling by police and the danger of just being Black while living is a danger to us in this country, certainly, but being well aware that we cannot live in fear. And our greatest resource has always been each other. From the very time that we arrived on these shores in America, we have always been able to support each other. In fact, there are some wonderful books that talk about our history of self-help. One is a book by Jessica Gordon Nibhart entitled Collective Courage, A History of African-American Cooperative Economic Thought and Practice. It's a great text that really gives a wonderful history of how we have historically uplifted each other. A lot of us are unaware that even to this very day, we have some very thriving Black co-ops in some southern states. Another great book is by Emmett D. Carson, entitled A Hand Up, Black Philanthropy and Self-Help in America. Another book that really documents our history of helping each other, despite the fact that we have been Willie lynched. And those of you who are listening might know who Willie Lynch is or was. And it doesn't matter whether or not he was a fictional character or someone who actually existed in real life. We know that the practice of dividing African Americans against our own interests is real. It happens politically, it happens religiously, it happens in every possible realm that you can imagine. But we do know that our strength is when we come together. We are our greatest resource. And being able to stay connected is so important. We know that families, because of stress, because of distance, because of whatever issues which are going on, we may find ourselves isolated. And our power has always been in our ability to come together and to be of mutual support, not just during the hard times, but during the good times as well. So while we are in this era of social distancing, and this reality may be with us for a very long time, we have to be willing to get outside of our comfort zone and maybe use the technology more often. We have Zoom, we have Dual, we have FaceTime, we have all kinds of resources available to us, and we have to avail ourselves of them, particularly when they're free. And to stay connected, because once again, our greatest strength is when we come together and actually support each other. So being very intentional about maintaining frequent contact with our loved ones, our family, our friends, our colleagues, using technology, online video services, and also telephone. I remember the one telephone provider years ago had a mantra that went something like this: reach out and touch someone.
That's right.
Well, we can reach out and touch someone through our technology. So as we're using this Zoom this morning or this afternoon, being able and willing to reach out, particularly knowing that there are some family and some friends who are isolated, who may not feel comfortable using the technology, it's upon us to really reach out to them and to maybe even set up their Zoom or their Facebook or their Dual or whatever they're using, so that all they have to do is just press a button to get connected. But even more so, we have to be willing to make it part of our daily and weekly routine. Reach out to our family and our friends. Stay connected, even if it's just to say, hello, how are you doing? I was thinking about you. That means something. Whereas too oftentimes we take our family and friends for granted because we know that they're there. But we need to stay connected, not just in thought, but when we think about someone, be sure that with our civic organizations, our fraternities, our sororities, our NAACPs, or what have you, that rather than focusing so much on meeting face to face, we can use the technology there again. We spend millions of dollars on conventions and conferences, and it's wonderful. It's nice to actually see people face to face. However, with this pandemic, I think we're challenged even more so to use this technology to do something outside of our usual boxes. So let's use this to actually connect, but not in a way that it causes thousands of dollars to travel across the country to a convention. Mm-hmm. Let's use this technology in this way. And there's something else that I need to say is that there's so much misinformation about COVID-19. I remember early on when the pandemic first started, there was a lot of misinformation that Black folk can't catch COVID-19. We know that that's totally foolish and very detrimental to us being able to really address the critical issues regarding this virus. So I would challenge us to get credible information from reliable sources. And while on one hand, there are some wonderful articles and news clips on Facebook and on other online media and even on the regular networks, we have to be very careful about where we get our information. While on one hand, our athletes and entertainers are wonderful in what they do, they're not experts on the virus, nor are they the best sources to get credible information. I would say that the Center for Disease Control and also the Colorado Department of Public Health and Environment have some wonderful web windows that you can actually pull down and actually obtain some current information regarding how to cope with COVID-19 in terms of the sanitation, social distancing, and other types of supports available. So we do have some resources available in addition to ourselves, but we have to make sure that we're able to filter the sense from the nonsense in terms of information regarding COVID-19, because we can actually harm ourselves with some of the misinformation. And some of our leaders are not doing a good job at being examples for how we should conduct ourselves during this pandemic.
Thank you so much for that. So one of the questions we received was regarding teens. Teens can be exhibiting depression differently. How do we identify that, and what can we do about it as parents?
Okay. Big thing, most important, be aware, be sensitive, and also be willing to listen, because oftentimes as parents, and I have 4 adult children, actually I have 5 now, it's very important that we listen to them rather than talk to them. We need to listen to them and engage them where they're at. Oftentimes one of the biggest complaints that teenagers have is that adults don't listen to them. And for the most part, that's true. We're too busy instructing them and guiding them in the way that we think is best without necessarily taking time to ask, how are you doing? What's going on with you? What can I do to help? These are just very basic fundamental questions, but if they go unasked, it's almost as if we're uninterested in their well-being from their perspective. So we have to ask the question and to also take time to listen. It would be wonderful if every day, since we're safer at home these days, if we actually make some time, even some set time or some spontaneous time, just to talk and just to listen. That's the biggest help. And also, if we do find that our teenager or another family member seem to be really distraught, dealing with the unemployment, the inability to go to school for young people, that we actually seek out professional help. We have this stigma that you have to be crazy to get psychotherapy, to get counseling, and it's not true, because we know that mental wellness exists on a continuum. On one hand, we have individuals who are quite adept. They're the highest functioning people in our society. Then on the other end, we have people who are psychotic, out of touch with reality, and most of us exist somewhere in the middle. And all depending upon what stresses are impinging upon us, we may vacillate from one end to the other of this continuum, because mental wellness is not a set point in time, or should say, it is only a set point in time, and it does vary based upon what stresses we're dealing with. And all of us are subjected to depression, to anxiety, to anger, and sometimes if our behavior is too extreme, we need to get professional help. And there's no shame in getting help The shame is getting help and not, or I should say, having help available and not taking advantage of it. So we have to be willing to ask the critical questions and to take time with each other and to make time, because too oftentimes we can be too busy, and all of us have things on our schedules, on our agendas, and we tend to fill up every wake hour during the day, but we have to really make time, intentional time, to connect with others. So there are people in our household, particularly young people, we have to be willing to let them know that they're important, that we're concerned, that we care, and that we're willing to listen and not just talk at them. Because as parents, we're experts at that.
True, true. Thank you so much.
So you're welcome.
One of the things I will share is that, the center offers a mental health first aid program. We have a couple coming up virtually, so I would invite anyone watching to check out our website for the schedule. Mental health first aid, it's a great interactive 8-hour course, and it basically helps folks be able to kind of understand and spot disorders in loved ones or friends or co-workers, and understand those warning signs of mental health problems. And it helps you build an understanding of the impact and some common treatments. We've got 2 virtual sessions coming up in June. We offer both for adults and also adults working with youth. So please visit our website, caahealth.org, and check out that calendar. Dr. Young, we had a wonderful town hall discussion a couple weeks ago around COVID-19. And there were actually a few questions that we didn't get to that were specifically around mental health. So one of them that you haven't already naturally answered, what do you think some of the long-term mental health impacts we might see from COVID-19 health? Oh, goodness. What do you think some of the long-term impacts of COVID-19 will be for our community?
Well, on the negative end, certainly there would be an increase of helplessness. We know that on one hand, we have been told by being American citizens that we are guaranteed certain protections under the law. That has not always been the case, and this has been more or less exacerbated by the fact that we have a pandemic and our physical needs are not being adequately addressed, nor our mental well-being. So I would dare say there would probably be an increase in a sense of helplessness and probably anger at the fact that here we are in the wealthiest nation on the planet, and yet we're not taking care of those most in need. So from a psychological vantage point, certainly there should be a fair amount of anger directed at those leaders who are mandated by the fact that they're in office to provide certain type of support for all American citizens, as well as African Americans. So that's one, the increased sense of helplessness, which stems from depression, certainly will be with us for a long time as we find more and more people becoming unemployed and out of school and disconnected physically from some of their social supports. On a positive note, one of the long-term effects of the COVID-19 may very well be that once again, as a people, we will come together and actually support our organizations, our businesses, and people who definitely have our best interests in mind, to be able to, if you will, resurrect our ability to be of mutual support, even more so with this pandemic. That could very well cause us to re-examine our priorities. And that's a very big issue as well, because too oftentimes we take things for granted, we take people for granted, we take perhaps ourselves for granted sometimes. So being able to maybe do more introspection and to figure out what is really important. What am I spending my time with, or am I wasting time? Being able to critically examine our own values. This is an ideal time to do that because we're home, many of us, and we have the ability to actually pick up some books and actually read and maybe get online and further delve into some of the issues which we've been concerned about but not willing to make time to really address. So the positive note is that we can always, as the old adage goes, make lemonade out of lemons. in these tough times, we have to be willing to not just recognize that, yes, we're living in danger, but guess what? This also creates an opportunity for us to come together and to reevaluate ourselves and our values and how we interact with each other. Because certainly it is too late to tell someone that we love them or to send them flowers once they die. We need to be doing that right now. We have to wake up every day, if you will, with an attitude of gratitude, because certainly the virus is not going to pass any of us by in some way or another. You know, we will all be affected either directly or indirectly. So certainly being able to just acknowledge what we're grateful for is a real strength when we're under stress. Certainly that can help to lift spirits as well.
Thank you. And that's so true. We have another question that just came in. What about heightened racial animosity during this time? Are there any suggestions you can make to the community about dealing with it?
Wow, that's something which we've been dealing with for a long time, since we came to America against our will. So we've always had this issue of dealing with racism, and that's being polite to call it racism. Really, it's white supremacy, which is a system which gets manifested in individual behavior of hostility and violence against others. But certainly the pandemic has some of our leaders come out with this mantra that we're all in this together. Well, yes, we're all in this together. We always have been as a nation. In fact, imagine America being a rowboat, and we're in this rowboat together. And you're sitting on one end, and on the other end is a madman. This madman is angry. He's trying to throw you overboard. Now the problem is that you're handcuffed together. So if he goes over, you go over with him. And yet we don't want to be attacked and subjected to violence of any kind. So we have to figure out how we can negotiate an existence with someone who is a mad person. And I mean angry and violent and irrational. When we think about racism, that's what the end result is. We're dealing with someone who is the hostile. They have a disregard for humanity, our humanity particularly, and have such disrespect. So we know that police shootings of unarmed Black people, both male and female, has been something we've been dealing with from the very beginning. That's not going to go away. That would probably exacerbate. We know that this whole issue about implicit bias that some of us are well aware of is not going to go away. If anything, we'll be dealing with more explicit bias. So it won't be so covert. So one thing that we have to keep in mind as we deal with racism and more hostility due to the stressors created by a pandemic is that we are not the problem. The perpetrators of the violence, they're the problem.
Thank you.
We just simply happen to be in their path. But really, we need to really understand the mentality and the mindset, if you will, of those perpetrators of white supremacy and the violence and the various types of hatred. We're not the problem, they are, because they're the ones who are causing harm. So we need to be sure not to internalize the hatred that other people have against us. And oftentimes when we find ourselves engaged in detrimental behaviors such as substance abuse of various kinds, physical violence against others, oftentimes if we take a look at the source of where the anger and the hatred came from, we're just simply oftentimes internalize that that which we should not have internalized.
And it's so true, and it's especially insidious because that force that is the problem wants us to think that we are the problem. So it is a vicious cycle. We are at 12:30. I want to thank you so much. Please come back again soon. I'm going to also get in contact with you because I'd love for us to post those book resources you mentioned on our website in case anyone wants them. Any last thoughts you'd like to share with us?
Yes. My last thought with you would be to stay connected and truly contact those people who you've been out of contact with for a while. Maybe you've had thoughts about someone, but you've not picked up the telephone. Call them. Connect in some manner, because once again, our greatest resource happens to be ourselves as a people. And as we find ourselves having opportunities to use Black businesses and Black organizations, use this as one opportunity to help strengthen all of us. That would be it.
Thank you so much, Dr. Young. I appreciate you, what you do and what you have done and what you continue to do. And we look forward to talking to you again soon.
Thank you, Deidre. Stay blessed.
So just want to let everyone know that the link for today's session will be posted on Facebook if you want to view it later and share it with friends and colleagues. We'll also have additional resources available on our website, caahealth.org. We encourage you to mark your calendars for next Thursday, which is our next Facebook Live Lunch and Learn. It'll be on May 14th at noon. Chef Lisa Givens, owner of Gourmet Away, and Yolanda Gautier, our Senior Living and Health and Wellness Navigator here at the Center, will be discussing food and nutrition during this COVID-19 pandemic. Thank you so much for joining us today. And as Dr. Young said, remember to take time out to spend time with loved ones. Think about your purpose. Please stay safe and healthy, and have a lovely weekend, and happy Mother's Day.